Hi, good afternoon. This is your Rockland County Executive Ed Day. Thank you for joining us for our latest County Executives Update. I'm here today, again, most people remember John Lyon, my Communications Director, the proverbial man behind the curtain. He has joined me today to get some information out to you. And it has been a little while since we last met, so I want to get you updated on some of the numbers. Right now, as a reminder, whatever information we're giving you is available publicly by visiting our website at rocklandgov.com. That's rocklandgov.com, and go to the dashboard hub page. A lot of information there if you're interested in catching up on what's been going on. Very positive news as a rule, though, I have to say that. As of yesterday, there are 656 active cases here in Rockland. Now, active cases are confirmed positive results. It could be asymptomatic people, could be people who are feeling significantly ill or just have symptoms of a minor cold. But those are results in the previous 2 weeks that have been reported to the Rockland County Department of Health by the state of New York. Pretty much all of the information that we get, we are relying upon the state for, just so people are clear on that. The number peaked to near 3,000 early January, but it's decreased in 2 waves since then. I'm going to show you the chart here. You can see where we were in mid-September. John, how are we doing?
A little closer. There you go. Yeah, okay. Perfect.
Mid-September, over here, you can see where we were, and here we are now. But you see the peak in the middle, how we went up. So we've had a couple of significant drops, as you can see, and now we're down to 656 cases. So obviously some really good news. Returning to where we were in mid-September of last year really is significant to all of us. You remember the summer was pretty much non-existent, but really had very little activity for the entire summer after coming back from a horrific spring. Hospitalizations, extremely important. We've maintained that from day one when others even weren't considering that. Hospitalizations have also decreased greatly from a peak of 107 in January to 22 people currently being hospitalized with COVID-19. That's for both hospitals. Extremely low numbers and very, very positive news. It's becoming more and more clear that as the vaccine supply increases and the strategies we have been utilizing or implemented are bearing fruit. You may remember a couple of months back when we activated our Emergency Operations Center, or EOC, to assist our Office of the Aging with registering seniors to help them book appointments. You do remember the difficulty we were having the way the state rolled out the vaccines. After much back and forth with the state, with my fellow county executives in the Mid-Hudson region, along with county executives across this entire state, the state finally relented to a great degree and let us do what we do best here, let our Department of Health take the lead, strategize to get to the conditions that we're facing here in Rockland County. So I can now report that these efforts were extremely successful. At one point, we had over 13,000 seniors on that wait list, and the wait list was only there for 2 reasons. Number one, obviously supply was still building, but more importantly, we're being told who to give the vaccines out to, and that just created another issue because, again, we felt here locally we knew best as to how to disseminate and administer the vaccines. And again, we have been through this already. We did vaccinations already with the measles, so we were well trained and well experienced. But right now, on that wait list of 13,000, every one of those people have been vaccinated. I want to take a moment to applaud the work of the staff from about a dozen county departments. This was not just the health department. This is an all-hands-on-deck effort at my direction. Our staff on all departments did an admirable job in jumping to and helping us get this done. Also want to acknowledge the Sheriff's Office, Sheriff Falco and his team, for maintaining order and ensuring that people were able to get in and out of the Building A in particular. It worked out very well. But I can tell you one thing. I have no doubt that because of these efforts, we saved lives here in Rockland County because we were able to rapidly turn the corner and get things done, get vaccines into people's arms at a pace nobody in Albany thought we could ever do. So I mean, I'm very, very proud of it, frankly, as a county executive here, because we use the tools at our disposal and we tap into the experience and the smarts that our people have here in Rockland County. Right now, according to New York State data, 41.1% of Rockland residents, or about 134,000 people, have received at least one dose of COVID-19 vaccine, and about 30% or 30.1%, just over 98,000 people have completed their vaccine series. Now, there has been some talk about people not getting their second shot. It's not logical. If you got the first shot, you really should get the second one. The efficacy rate for a single shot hovers close to between 75 and 80%, which is good. But since you had the first shot, it really is logical to take the next step, get your second shot. That brings you up to 97% efficacy, which is tremendous. And also, we're told by the science that this will help also in any variants that may come our way. We believe that this is a factor in our decreasing case numbers and lower hospitalization rate. These are just some of the benefits of now getting vaccinated that we know and beginning to see. Last night I saw a presentation on TV, CDC, and a study that was done on seniors, and the impact of vaccinating